Cool. All right. So, Jim, before we get started, I was wondering if you could talk a little bit about yourself and what your firm does and how they help healthcare brands.
Sure. First, certainly appreciate the opportunity to be with you this afternoon and get a chance to visit with you about some important things that are going on in healthcare today. I think True North, we have the opportunity to partner with marketing executives at hospitals and health systems across the country to solve problems through data-driven content strategies. I think that's the part that's been most successful for us as we engage with our clients to bring value to them and their organizations.
That's excellent. So, Jim, as somebody who has been a healthcare administrator executive for much of your career, I think probably as well as anybody what it's like to have the weight of a hospital or health system on your shoulders. Can you peel back the curtain a little bit and tell us, as administrator, what are some of those 2 a.m. thoughts that you're having as far as where the system is going, the state of the economy, anything and all, everything?
I think that's a great question, and one of the pieces of the puzzle that I think there's a old expression out there. When you see one hospital, one health system, you've seen one. I think there's a reason that is out there in the marketplace, and because of the unique aspects of each market. Each one in today's world, from my experience, are rotating on their axis. They're rotating at a different speed than their colleagues in some other part of the country. As everyone is continuing to make certain they're creating the most value for the community they serve, while at the same time continuing to be successful in developing value-added capabilities and being successful in their market. So there's not just a standard, I think, set of questions that CEOs and their CFO colleagues are asking. I will tell you, many of the similar pieces of the equation are: how are we going to produce the highest quality product? How are we going to continue to grow our volumes, grow our market share, grow our footprint, if you will, and do that in a way that creates the best patient experience that we can. Increasingly, we're seeing customer and consumer involvement, if not driven healthcare decisions that are much more meaningful today than they have historically been.
Jim, oftentimes marketers, when they're in front of a CEO, CFO, COO, board members, those audiences are talking to the marketers about very specific financial goals, very specific needs the organization must make to fulfill the mission. And I was wondering if you could talk about some of the financial terms that are often used in the context of revenue for a hospital, just so we can have a better sense of what are the key things that we need to know.
Well, I think there are increasingly, you're going to hear the value-based purchasing propositions and reimbursement models. And you'll hear, depending on your market, discussions around the different reimbursement models that are evolving, whether it's bundled payments and whether or not it's the development of clinically integrated networks. I think those pieces are probably things that most of us understand and get our minds around pretty well. The part I would encourage each of us to do is to understand sort of the mechanics behind that at a reasonably detailed level. Your CEO, your CFO, and oftentimes your board members who have spent a considerable amount of time learning the intricacies of a healthcare delivery system and its operations. They understand the intricacies of those financial statements and the mechanics. So for our marketing leadership to have the same ability to speak to those in that language in depth, I think is important for them as they try to communicate with a increasingly wide constituency of people that are involved in a successful delivery system.
Great, Jim. And just as a follow-up to that, when you talk about financial statements in general, what are some of the terms, names that might get thrown out? Like, is contribution margin or net revenue, is that kind of thing that part of the conversation?
Oh, absolutely. In terms of how you're measuring the success of different initiatives, I think those metrics that you're talking about, whether it be contribution margin, ROI is one that you'll hear used frequently. Understanding those pieces, I think having a meaningful connectivity with the CFO and the finance division to know on a local basis what they are looking for and how they define those given metrics becomes important. Otherwise, if you're not using the same definition for the same metric, you create some confusion in the discussion. So the goal is to, from my perspective, is to speak the same language. You know, it's a key part to communicating. If you think about traveling abroad or going anywhere where people speak a different language, you appreciate the importance of knowing that language to be effective. And so each discipline in healthcare has their own sort of language, whether or not it's within the planning division and function and discipline within an organization, the finance division and discipline, the marketing division and discipline, the chief medical officer and the language around the quality of care, the managed care environment. For the marketing leadership to understand how those contracts, those managed care contracts work, what increasingly the quality metrics are that drive the results of those become, increasingly important as you develop an effective marketing plan and strategy to drive the right message to the right people at the right time to achieve the desired result that the organization is looking for.
Excellent. And so, Jim, along those lines, I'm hearing you say something really great, which is you have to speak the same language. Make sure you're on the same page. If I'm using this phrase as a marketer, it's because the CFO is using that same phrase and it means the same thing.
Correct.
So, Jim, could you just give us, top of your head, a couple phrases, words, things that marketers in the C-suite want to be on the same page about?
Well, I would tell you the budget process for most organizations really becomes an operating plan. And when you think about an operating plan and how it's developed, it oftentimes begins that process by defining what some might refer to as global statistics, of defining your volumes that are going to drive that business plan budget for the next fiscal year. So those start with accurate projections of admissions, surgeries, emergency room visits, and patient days, the things that will drive an income statement and a cost structure. So understanding those volumes, and I think, one of the opportunities with CRM capability is to have the CRM volumes and projections more tightly connected to the global statistics that drive the operating budget. Those numbers are understood well and deep by the operators, by the finance division, usually by the physician leadership team as well, because those are the things that they've worked through and agreed upon are the numbers that are going to be behind their operating plan and budget for the next fiscal year. So from a marketing leadership perspective, if we're coming in and we're doing a service line campaign to effectively drive orthopedic surgery, we need to make certain that our projections and our volumes and our impact connect tightly back to those operating budgets and plans, business plans, so that, again, we all have a consistent framework and starting point of what it is that we're chasing, and from a metric perspective, and how we're defining success.
Excellent. So, Jim, I know your firm offers a CRM product, have been in that space for quite some time. You're experts at that. A lot of times when we talk with marketers, a lot of the challenges they face is maybe they don't have the budget investment or the buy-in to buy into a system that could allow that greater level of connectivity. So in general, why do you think it's so hard sometimes for marketers to get an accurate sense of how their campaigns are performing financially for the organization? There seems to be this gap between we do this and we see that there's activity over here, but we can't put a dollar amount to that. Do you have any ideas as to why that gap exists?
I think the what we've seen be successful is the ability to connect the strategies and the tactics to the actual results of a campaign. So again, tying on the front end to what those volume projections are, and then in a tight fashion, connecting the strategies and the tactics to whatever the results of those volumes, or if it's a population health model of whatever the actions that you were trying to be effective in driving in the marketplace, to be able to bring those back. I will tell you, I think the opportunity to connect those then back to a financial indicator or metric is going to be largely based on the ability to build that on the front end of how we're measuring and how we're going to look at contribution margin, how we're going to look at and define ROI effectively before the campaign and the initiatives are launched, to have that level setting. Got
it. So Jim, you had said something earlier which I really like, and I will quote you on it in the future, which is, if you've seen one hospital or health system, you've seen one. And it seems like within the organization, if you've seen one service line, you've seen one. And I keep hearing you say, speak the same language, get on the same page. So what would be some rules of thumb you might recommend to a marketing person who's trying to do that, who's trying to, say, help the organization drive more joint replacement surgery, and is meeting with that clinical team and those advisors? Like, what are the bones or the agenda for a good beginning conversation about how we can agree on what we want to measure, what we want to achieve, and how will we know when we're successful?
It's an important part of how you build your marketing plan. I think of having the constituencies that are going to be engaged in assessing that plan involved at the very beginning. So the service line leadership, marketing leadership, and some participation from either a planning leadership and financial leadership, and physician executive leadership, because as we move through the strategy development, the tactics, and the implementation on down the pathway to the effective measurement of success and understanding where we need to adjust, I think you're going to have the value of the insight and participation in each of those different disciplines to be successful and to be effective. And again, I think a key piece to it all is to have active participation from each of those disciplines at the outset. And I think that ends up positioning everyone far better as you manage your way through the campaigns, assess the results of the campaign, and then ultimately assess whether or not you achieve the desired goals.
Well, I think you may have answered this kind of second to last question, but I'll ask it anyway because I was going to ask you that this question, this idea that marketers often have a hard time persuading uh, leadership of the value of marketing. But I was going to ask you for some advice on that. What could marketers be doing differently to earn more of that influence and that persuasion?
You know,
Uh, Go ahead. Yeah.
Yeah, no, I think it's what we participate in here at True North and have seen be successful as we've worked with again hospitals and systems across the country is the greater participation and understanding that we can have with the different disciplines, and the better we're able to use their lexicon, if you will, and their language around what the goals are and what we're working together to achieve. I think that is a key piece to having the ability to be influential within the organization. If we're waiting for everyone to come to us and to understand our language and our process, I don't think that that we'll have quite the same level of success.
Great point. Great point. All right, Jim, last easy question for you. If people want to learn more about you and your firm, where should they go?
Well, I always feel free to reach out and contact us directly. We've got a blog out there that certainly provides information on a frequent basis, as well as our website. So look forward to connecting with everyone. For those who have the opportunity, I'd encourage you to stop by our booth there and get a chance to visit with our team and see if we can find some ways to work together to help you be more successful in what you're trying to achieve within your organization.
Great. Well, Jim, thank you so much.
Thank you. Appreciate the time and enjoyed the opportunity to visit with you.